Here on the newsfeed late night, there's an elevated sense of anxiety after the detection of the so-called Indian and UK variants of coronavirus in South Africa. This was confirmed by the Network for Genomic Surveillance this weekend. Health Minister Dr. Zweli Mkhize has urged the public not to panic. And on the issue of travel restrictions, Mkhize says any discussions on the closure of borders will follow a balanced approach in order to protect the economy. But is that response good enough? For more on that, we're joined in studio now by clinical virology specialist Dr. Zweli Mkhize and Wits School of Governance Professor Alex van der Heever. Good evening to you both, and thank you very much for your time. There are two things that are clear: is that there's a new variants that have been detected in the country, 4 of them in particular, and our borders are not closed. And Professor van der Heever, there's a sense that people feel something should have been done and was not done, and somebody must be held responsible. Is that a correct perception?
Not sure it is. I think it's very difficult to keep people with different variants out of a country using border controls. The variants are going to emerge in many different environments, and you can't protect our borders from all countries and all people coming into those countries, and you also can't prevent the variants from emerging domestically as well. So what we really have to focus on is preventing the sort of expansion of the spread in South Africa. So we've got to basically control the super spreading risk and maintain vigilance on managing the domestic spread. And that is the best route forward that we will have. We will not keep variants out. And the variants are going to keep on emerging no matter what we do. And border controls are just going to restrict activity in a manner that will not contribute much to controlling the epidemic at all.
I mean, if you look at other countries and how they've responded, for example, to these new variants, if we are talking, for example, Kenya, they have banned flights from India. We read in a statement that the 4 cases of the B1.617.2 has been detected in Gauteng and KwaZulu-Natal, and all have a history of a recent travel arriving from India. Dr. Msomi, does that tell us anything about how we are managing this process?
Good evening, Thabo. I think what it tells us is, yes, there have been importation to South Africa, but it does not necessarily tell us that there is laxity in border control or surveillance in the country. And what is also reassuring is that the speed at which these first few cases were detected shows that there is active surveillance and they were easily detected, ensuring that there was a proper contact tracing and isolation to prevent further spread from those importation events.
Yeah. Is that the key here, that we increase our surveillance as opposed to the calls to say, well, just limit the virus from actually coming in, or the variants at least, because the virus is already here?
I do not think there is a one solution for everything. I think using as many different public health measures to control and prevent the spread of infection is wise. So yes, surveillance is definitely one part of it, so that we can always know what's circulating in our country, but also being strengthening the screening and testing of our ports of entries to ensure that we limit the entry of importation of these variants that are different to the South African variants.
Prof. Alieva, now that, of course, the variants are here, we have increased surveillance, but what does it actually mean in terms of the spread of the virus? Does this mean now we're going to be seeing a new upsurge in the number of infections?
We'll see an upsurge in new infections because of human behavior, largely, not necessarily because of new variants. So the question really is whether we're managing those high risk context where super spreading is a risk. What we're probably seeing in India, and I say it's not conclusive, is not that the wave that they're experiencing there is because of the new variant. It's just that the new variant has got caught up in a wave. And they've allowed massive super spreading events to occur in India, both political party campaigning as well as religious events, which have clearly contributed to super spreading. So the variant gets caught up in that, just as the B1351 variant got caught up in South Africa's second wave. We can't say that it causes the wave, but it certainly becomes a dominant variant in the wave just because of how the super spreading initiates a sort of a very large increase in new cases. So I think we've got to concentrate on where we've got people coming in. We have appropriate measures such as surveillance and testing and tracing in place there, but we probably have to look very, very carefully at managing the risk of a wave, regardless of which variant is involved. And I think we're now looking, for instance, at a worrying rise in Gauteng, which probably raises the question that the minister was also raising as to whether or not we do need to have some preemptive restrictions now rather than when the infections get to a very extremely high level and break the sort of chain of transmission as early as possible.
So Prof, I'm hearing you clearly, because the concern and the worry from people is that, now we've got this variant in South Africa, which we have seen spreading so rapidly and so dramatically in India. It's going to do the same thing here. What you're saying is it's not the variant that is doing that. It is the lack of management in India that has caused this variant to be so prevalent, plus the super spreader events, plus all the other factors, including political rallies and so on and so forth that was going on there.
Yes, exactly, and it's what caused our second wave as well. I mean, we got lax. People thought it's over, and we had people behaving extremely badly. But I think that the problem is that the longer we keep the transmission at relatively low levels, the more complacent people become. And so they start taking risks and chances and thinking they can gather in large groups in unsafe settings. And it starts to reemerge. Certainly in those areas where we still have very large susceptible populations, people who haven't been infected. And a province like Gauteng still has a very large susceptible population. Provinces like the Eastern Cape have a lot less because they had a very large proportion of their population potentially infected in the second wave. So they might actually be less susceptible, but Gauteng's at high risk. So we have to keep close eye on managing gatherings. And we saw that, in fact, the restrictions that targeted gatherings in December and early January worked. And so regardless of the variant, targeting the gatherings has a massive effect on transmission. And so we should be looking very carefully at what we introduce at this point to prevent the surge from getting too high prior to us vaccinating enough of the population to minimize the risk. We're still way behind on the vaccine program, and therefore we do have to look strategically at restrictions.
Yeah. Dr. Msomi, does the fact that one of the variants, at least the one that we know more about, the UK one, does not escape immunity, is that a good thing? In other words, the vaccines that are available are able to deal with it, and what does that mean for us in South Africa?
That is certainly reassuring, considering that now we have that variant that was initially identified in the UK being identified in South Africa. The fact that it is shown to respond to the vaccines that are currently being administered here in South Africa and the ones that we are awaiting arrival of, it is reassuring indeed. Yeah.
And so, I mean, in a time like now where we actually don't have those vaccines, we are not going to find ourselves at a later stage seeing, well, it was in South Africa, it has mutated into something else, and now the vaccines are no longer effective?
I do not necessarily think so. Also, what is viruses will invariably always mutate and variants will form. But what has been reassuring, especially with the South African strain that is circulating in South Africa, is that the immunity that is mounted against that vaccine seems to also neutralize against other variants, and that is comforting. And the evidence that has come from countries that have administered the vaccines and the tests that have been done in the labs against the variants, it's showing that these variants are not escaping vaccines as we thought they would. And what's especially more important is that they are able to prevent severe disease and mortality, which is important.
So many South Africans are just asking the question, are we, Prof. van der Heever, looking at or being informed by the best available scientific data at the moment more than the economic considerations?
Well, I think we've learned a lot during the process of this pandemic, and I think that a lot of the people who are focusing on what to do are taking into account a very significant amount of information that is being released in real time. So I think that we are in a position to react in a much more sensible way than say March last year, where in fact our restrictions didn't even adequately target gatherings, high-risk gatherings and super spreading events and airborne transmission, whereas now we do. So I think that we are being advised by the best available strategies, and I think that we are also able to surveil to a much greater extent than we were able to last year. A lot of things are geared up now for this. I think the main issue is making sure that we make key decisions timeously and make them and keep the population well informed. But I think it is very useful that an immense amount of information is becoming available very, very quickly, and it's good information, and it does allow people to make reasonable decisions. Just to note that other countries are not necessarily following the path that South Africa might take in terms of border controls, but very often they're doing it for political reasons, not because they're being advised by the science. And it's important to note that variants themselves might surge in India, for instance, or in South Africa, but they may not have even originated in these countries. They kind of originated somewhere else, but they just get caught up in a wave in that particular country, and so it becomes associated with them. So I think that taking all of that into account, we've got massive community-based transmission everywhere in the world. We've got to manage the epidemic through a combination of restrictions and vaccines and slowly build up immunity and just keep going. But I think we've got to minimize the extent to which we take long-term economic decisions when we do that, manage gatherings, manage border protections without closing them, and manage super spreading events and vaccinate.
Prof, appreciate your time. Dr. Msomi, and thank you very much for joining us.